So some of the parents have been asking lately, what are some of the conducts that we can expect to notice on our children after receiving stem cell therapy? And today, Dr. Eduardo is going to give us a few advices on how to ease those behaviors.
Thank you very much, Michelle. That's actually a very interesting question that I get to hear a lot here in the clinic during the consultations. What can they expect in the immediate afterwards, after receiving the therapy in their child? Talking about behavioral issues, for example. Well, I don't consider hyperactivity as an actual behavioral issue, but we get to see an increase in hyperactivity in about 80% of all of our patients during the next few weeks, lasting up to even 2 months. Okay, this is something that we get to see very common. Again, 80% of our patients. Why? Because after the therapy, most of these kids that they were not fully verbal, they start to receive information from the environment that they were not used to be capable to receive before, or they are exposed into a bunch of new stimuli that they didn't perceive in the past. So this information might be too much at the time or a little overwhelming to them, and they end up reacting, being more hyper, or even showing more stimmings or even tics. Again, these behaviors, if they increase, they will just last for no more than 2 months. This is something that automatically will fade away on its own. You don't have to do anything about it. It's something that we are actually expecting, and means that the cells are working. What you can do is exposing your child into, again, new situations, getting his brain challenged the whole time, and if possible, expose him with other kids into group activities, such as outdoor activities, sports, or taking them out to different parks where he can get along with other kids, and where he can mimic behaviors from other kids which are not in the spectrum. Remember that kids in the spectrum, they imitate or mimic a lot behaviors from other kids that they see. So if we help exposing them with other kids their age, or even older kids which are not in the spectrum, this might be beneficial at the end in order to see or to show improvements in behavior. Right? Please stay tuned, and remember, this hyperactivity, if ever developed by your child, is nothing bad. I know that you might be a little tired because most of the kids already suffer of some level of hyperactivity, and if it increases a little bit more, I know that it can get frustrated at the time, but what we can do is trying to get them as much as tired as possible doing physical activities and following the instructions that you will receive from our specialized therapists in ASD diagnosis, occupational therapy, and speech therapy. Please stay tuned, and we'll be sharing new advices soon. Bye bye.